Hey, everybody. Welcome to the first episode of the year for the Executive podcast, where we talk to entrepreneurs and executives and operators and get their life lessons and advice on how to make it at the highest level. So excited to be joined today by Joanne Mizell, who's the Chief Operating Officer for Banner Aetna, who we were fortunate enough to have Dr. Groves, who's the Chief Medical Officer, on in the past, and where Banner Aetna is a joint venture between Banner Health and Aetna, which we'll do a quick recap of that. Joanne, so great to have you on.
Thanks, Matt. I appreciate you having me.
Absolutely. Joanne, you're maybe we start with just because there may be a few people that have listened to the past episode on Banner Aetna, but would love just a quick recap on the joint venture, what it means, and what is Banner Aetna really trying to achieve with the joint venture.
Yeah, great way to start. So Banner Aetna is a joint venture. We are half owned by Aetna, who most people have probably heard of, regardless of where they are in the country, and half owned by Banner Health, which is the largest health system in Arizona, and they're also in other states as well. So we're, like I said, a joint venture. We are a separate company, not a subsidiary of either. We have our governing board that we report into, and a C-suite structure that's separate from either company, which is sometimes unique in joint ventures as well. And we are operate in the state of Arizona. So employers that buy health insurance in Arizona, and now individuals who buy health insurance in Arizona, most of Arizona, are buying from Banner Aetna rather than Aetna. And so we're a statewide, pretty good sized company, about 400,000 members at this point in time, and we are on our, I think, 5 days into our 6 year
Oh,
anniversary.
it's exciting. Yeah, congrats.
Thanks.
And as a refresher, what was really the thesis around the joint venture? What is the main thing that Banner Aetna is trying to solve for?
What we're trying to solve for is our owners are two really large companies, and both of them got together. Two companies that traditionally are adversarial. I don't mean Banner and Aetna, but health systems and
Right.
payers, traditionally very adversarial. Probably the most adversarial relationships in the healthcare ecosystem. And these two saw synergies in working together, that they had like mindsets about how the somewhat, and I say that kind of tongue in cheek, it's probably more than somewhat, broken system has a lot of opportunity that if we join forces, we could fix together. One could not fix it alone. And if we did it in the state of Arizona, we have a smaller landscape to work with, and we can really try some new and different things without breaking either company. So that's kind of what we're trying to do is
Mhm.
improve the healthcare system for members, for providers, for employers that buy in that system, and to really make it smoother, more affordable, and just a better overall experience.
Very cool. And I know you're challenging, you're tackling some bigger problems in the industry, which we'll get into. But
Mhm.
talking about you first individually, you've been in the industry for 30 years. What got you into doing a more of a not a startup, but kind of a little bit of a startup early on venture? What got you excited about the opportunity?
Yes. So when I started in fifth grade, kidding, 30 years just sounds so long, but
Yeah,
I what got me interested in it is I did spend about 30 years in all aspects of this business. And I could see what worked, but I could see so many things that didn't work. And there seemed to be an acceptance across the industry that that's just how it is. And, when you're a patient on the health system side, it's so challenging, and it's so confusing and so difficult, even for me and my family who really
yeah,
understood how it worked. That there was just this opportunity I saw, that if anyone could do it, this is the relationship that could have an impact and change it for everybody, not just for me and my family, but really for everybody. And if we're able, Banner Aetna, to create improvements in the systems with the health system partner, then just like everything else in our industry, others will follow, and it just
Yeah.
elevates the whole industry. So for me, spending a lot of years in a really big company, a couple of really big companies, I saw this opportunity as one that we could try different things and pilot and really build something that makes it better. And we've been able to do that. So that's kind of exciting. And there's a lot more that needs to be done. So I'm excited about that too.
And some of those things I know are one, simplicity, right? Try to simplify the health system for the general person.
Mhm.
And I think one of those items is just billing in general, right? When
Right.
you get multiple bills from different people, you don't know which ones should you pay all of them, where they're coming from, and it's just very confusing. I think one thing that you've really spearheaded is this new billing system that's frictionless, and that you get one bill and it's very clear what it's for. Can you talk about that a little bit and why that's so important?
Sure. So when I first started at Banner Aetna, and when the company was brand new, we did focus groups and we did a lot of surveying and got some really good information about what the pain points are for members. And the number one item that came up, which actually surprised me a little bit, but it was across the board almost every time. Number one was understanding a explanation of benefits from the insurance company and having to reconcile that with your health bills. That was the biggest thing that members were confused with, and they didn't trust anyone.
Hmm.
So we figured, since we have the health system and the payer together, we can take the member out of the middle of having to do that reconciliation by sending them a single statement where we and the health system have agreed that this is the billed amount, this is the coverage amount, this is the paid amount, and here's your bottom line, member, this is what you owe. And that sounds like it should be super easy, but
Right.
we knew it had never been done, and it's a big problem, so it's not easy. Um, Being in this relationship with the health system, we saw the opportunity to build it. The solution wasn't out there to buy. We looked at vendors, but we had the ability to build this solution and to present to members at the end of the day, at the end of their healthcare experience. Here is your single source of truth. Here is what the bottom line, after what you've paid, after what we've paid, after what's due, what you have owed to you. And so the goal was to really create that simplification for that really confusing part of the healthcare experience.
Yeah, I mean, it seems like something that is so obvious, right? But for anyone
Right.
who's gotten a bill, they know that it's just not how the system works. And
Right.
so it's so interesting too that you would have to do this joint venture, right? And to actually to build something like this, that to simplify
Right.
it.
Right. And hopefully
Um,
we're inspiring others to do it as well. I like to create differentiation and do
right.
things that really help Banner Aetna to stand out. But ultimately, we have to elevate the whole industry, right?
Right.
And make it better, because the industry hasn't changed enough over the years. So
I think that's what's cool about what you're doing is your team seems very focused on, for sure, you want to be successful as an organization, but you really want this to improve everything. You want to elevate everyone else's game, and they start innovating and making things simpler. And like you almost don't mind some copycats, so the industry
yes,
improves.
we just want to be first.
Right. That's right. The
Copycats are
first mover
fine. We just want to
advantage.
be
Yep.
first.
I want to talk about a little bit just your COO role and stepping into this. What COO I think means a lot of things to a depending
Mhm.
organization. What are your responsibilities? Where are your focus is as a chief operating officer?
Yeah. So it sounds like a really boring job. And when it was first presented to me to consider, I thought that, because it's, operations, that's really boring. What's so that is the baseline. I need to make sure that, all the systems, every aspect of our business is running smoothly. So I oversee the operations, I oversee marketing, I oversee compliance, all of those things, which, aren't really that exciting. Having that background though, and getting a full view of how the company operates from every angle, um, allows me to do the fun part of the job, which is to innovate and to
Mm.
find solutions, new solutions for problems like the billing, frictionless billing that we created, that statement. Find solutions just to problems that are out there today. And there's a number of them. They're not unique to Banner Aetna. They're industry problems, and it's exciting because there are a lot of startups that are focused on these kinds of things. So I get to interact quite a bit with startups, and our entire leadership team does. And we evaluate tons of companies that think that they can help us with some of the solutions we're looking for. But that's kind of the fun thing, doing that evaluation. Really, the fun part is when you find that
Mm.
solution that's going to work, whether we build it or we vendor it out, and then implementing it and making it work for our members, and communicating in a way that they understand. So that's really the more fun part, and the part that drew me to this role was definitely not the keep everything running. It's
Right.
let's
Yeah.
fix some things, and in this role I do have a lot of opportunity to find solutions for problems that exist.
So when you say you're working with a lot of startups, because we've had quite a few startups on the podcast, what are you doing with, are you looking for partners for certain problems instead of building that, internally? Like, what kind of work are you doing with startups? What are you looking
Mhm.
for?
If if it's not something we can build in a 24-month period ourselves, we typically will be looking at outside companies, and they don't have to be startups. Some of them have been around, but we found our telemedicine vendor that way, just doing a really broad review of the market, calling in companies to do presentations and demos, and then we ended up settling on 98.6 as our partner
Okay.
that we settled with for primary care. And finding, you just have to go through, there's so many of them, and a lot of them come to us and pitch us, and we want to make sure that they really have what they say before we engage at our leadership level. uh, and and we're looking for not me toos that are all out there in the market, but what does that vendor do that really elevates the experience for the member and makes their lives
Hmm.
easier. So in that example, we went with a vendor that didn't have a copay for members using the service, and that appealed to us because you know every time you use your health plan, there's typically a cost involved, and we wanted to be able to provide something for simple care that people needed that didn't cost them anything extra beyond their premium. So that was one example. We also engaged with a a company for diabetes reversal. So tons of companies out there that do.
Yeah, I
Uh,
think you're talking about Verta, right? Verta
yes,
Health.
yes,
Yeah, with
that
Meet
do.
Shah and the rest of the group.
Right.
Yeah, great
Yes. So you
team.
know them. You know them.
Yeah,
It's that was one we what was unique about that and what we liked about that, it wasn't managing a disease, it was actually reversing a disease. So
yeah.
we're just looking for those that we want to have an ROI, we want to see a return either on experience or that has value, or a financial return. And if a company can show us both, then that's really what we're looking for.
Yeah, that's encouraging. I'm sure to a lot of startups too to hear, right? Like companies like yours that are well backed are looking for partners in a lot of different areas.
Mhm.
Um, so you've had quite a few different roles coming into this and do your CEO type role. What would you say were the experiences that were really fundamental and helping you in the day-to-day things you're doing now? What kind of experience was so helpful?
Over my career, I wore a lot of different hats, and I got to understand our industry from pretty much every angle, every way you can look at it, from every stakeholder's viewpoint. And there wasn't one role, but all of the roles together helped me to understand how it all works and what doesn't work,
Hmm.
where there are gaps that really need to be fixed and that hadn't been addressed. So I can't say it was anything specifically. I did have opportunities in my past working with some very very large uh, companies that were very innovative as customers and wanted to try and build things that we didn't already have and partner with us. So I did get early in my career opportunities to create new products with those customers as our pilots that are still in place today. And that definitely prepared me for this, getting involved in the regulatory side of that, and in addition to the operational sides and things like that. So that was helpful. And then uh, one of my one of my roles, I had the opportunity to build a platform within Aetna to provide an easy way for customers to buy different services from us and not get, again, like the frictionless billing, not get 20 different bills. And through that process, I worked a lot with procurement and with um, outside companies, some startups, some more established, to build this. And that was a great experience as well.
And I think a lot of people, some stay in a certain role for a really long time, right? And eventually get to the CEO role. Some others bounce around and take different experiences and end up in the same type of role that you're in. Would you say there's a better path to go get different experiences in different places and bring that together? Or do you find sometimes it's better to stay in the same company a lot for a while and really understand before going to the next role?
I, I can only speak from my experience, and everyone has their own path to where they are, and they're never the same. I think staying at the same company that doesn't change and in the same role probably isn't a good way to grow and learn. I stayed at one company for 25 years, but had a lot of different roles,
Yeah,
and a lot of change in that company. And I think that helped prepare me as well as some of the things I did after that. But I can't say that one way is better than another,
right.
except that doing the same thing for 20 plus years, I don't
That's
think
fair.
is
Yeah,
is going to help anyone. I think a lot of I do think a lot of people think they have to bounce around to different companies to get that experience.
yeah,
For me, I feel that staying at one company for a good part of my career helped me get a deeper understanding than I would have if I just, scraped the surface at a number of
right.
companies.
Yeah, it's a good point. In a lot of ways, to the top of the mountain. Um, for you, you're overseeing a lot of different departments, which means dealing with a lot of different type of people with different responsibilities and different key metrics that they need to hit. How do you best, like, what's your advice on just managing multiple departments and keeping track and making sure that all your leaders are in a really good place?
I've always had organization as a very strong attribute.
Yeah,
Very very organized, which helps. I do meet regularly with the heads of the different areas and stay updated on everything they're doing, and have a lot of one-on-ones and that sort of thing. But it's also really helpful to bring them all together regularly, so that everyone knows what everyone else is doing, because
yeah,
none of it works in a silo. In our industry, certainly everything is connected to the next thing, and even when you don't realize that a role that someone is doing in their silo is connected to a member experience that needs to translate into your sales, and you have to be concerned about legal and regulatory and things like that. So we do regularly meet once a month at a minimum with all of the leaders that support us, and everyone goes through and gives an update on what they're working on, and it helps a lot doing that.
yeah. And I think that we've heard that more and more, and how important and from just different leaders of how important it is for every different division to be talking to each other and
Mhm.
more consistently, right? So
Yes.
product knows what sales is hearing from customers, right? And there's that link so that product can actually create something that the customers want, that salespeople are
Mhm.
talking to them about. And that's the same for marketing in a lot of different areas.
Right.
Um,
I think it creates collaboration between the
yeah,
departments that wouldn't just organically exist also. I can
right.
help with that, or maybe I could provide some
Yeah.
insight. So yeah.
You have to be so intentional about it, right? Because I'm sure people are thinking, why do they care about what I'm working on? Like, this is nothing to do with them. But you have to break those barriers down and be like, it's really important. You got to share what's going on. Yeah.
Sure.
What are the things is, you've gone through your career that you would say have been the most helpful to you, either the advice you've received, different experiences of situations, like what have you just generally in leadership have been some of the best advice you've seen or gotten from others?
Yeah, I don't know that you get a lot of advice and you take some and you don't. I think the best thing for me though was really learning to work with a lot of different types of people
Yeah.
and styles and doing like I said, a lot of different things, like never saying that's not my job.
Yeah.
Even early in my career when I had a very well-defined job, I was always thinking, well, if I learn this other job and help this person out, then I can be ready for my next role. And
Right.
I think that served me well, always. And then the other thing I would say is when there's an opportunity presented and I have felt I'm not ready for that, or I don't think I can do that. I uh, I can't think of a time when I have said no
Yeah.
or I need to wait. I jumped right in and scared to death and just made it work. And I think when you're in that kind of mode, at least for me, you work really hard. You work harder than if you were ready for it, right? You
Yeah.
research. You want to understand everything, and that has been really good for my career development.
Yeah, that's a good point. You say yes and then you figure it out, right? You don't just go in there and not do the research, but you say
Right?
yes, then you start really working hard
Yeah.
to figure out and be prepared so you can be
Hmm.
more confident. That I
Hmm.
love that. What are the things that your team is working on right now and that you're really excited about? I don't know if you can share it or not, but what are some of the initiatives that are the hard problems that you're tackling with your team?
Hmm. So we are one of the hardest problems in our industry that we're tackling is the experience when prior auth is required for a patient before they get services. It's not a pleasant experience, rarely, and it's supposed to work behind the scenes. And it doesn't always go smoothly because, certain things have to be known about the situation and they're not always known and that
Yeah,
sort of thing. So for this year, that and really attacking that problem is one of our top priorities, and we have a number of ideas. I won't go into those right now for how to
it's
do it,
fair.
but that is a problem that we are extremely focused on solving for this year. And our other big one is behavioral health and
Mm,
emotional health. We have a lot of options and services available to members. But when a member is in the throes of needing that care, it's really hard for them to kind of decipher what the options are, virtual, in
yeah,
person, the different types of options. And it's not that we have a lack of care options available, it's just getting it to members where they understand what their options are and giving them that choice. So, the second big priority we have for this year is creating a really easy to use and comprehensive navigation tool, whether it's telephonic, where someone helps you find it that way, but ultimately we'd like it to be digital. where you
Yeah.
can know what your options are. So those are, I think, two of the really big things that we're focused on this year, that are problems we all have. And again, the emotional well-being has really, that need has really
Yeah.
escalated in the last couple of years since the pandemic. And we just
Yeah.
need to make sure people are getting that care that they need.
We talked about this a little bit with Dr. Groves. Where do you start with big problems? Like, how do you even start, right? Do you get around in a room with the team, tactically and say, here's the big problem. How do we tackle this? Like, where does it all start mechanically?
Yeah, it's it it mostly comes out of an experience.
Yeah.
A member had
Mm.
this experience, and we dissect it. And the member, has a bad experience. Obviously, we
Right.
dissect it and figure out, where did this fall apart and how can we fix it. Most of the time, it comes from that.
Yeah.
Um, Other times, we do a lot of surveying of members to find out where the biggest pain points are, or what they would like to see better. So that helps us a lot. And then between Aetna, Banner Health, and Banner Aetna, we have joint operating committees that brings everyone together to focus on specific areas. So we have clinical, we have sales and marketing, we have different uh, network, those kinds of discussions, where we hear from the health system, we hear from the insurance, and we try to come up with solutions that somebody has found as part of those groups.
And so you're basically taking it, find the problem, and you just start working backwards and dissecting it when you say that.
In most cases, that is the case. Yeah.
Yeah.
So we're not out shopping for problems. We often get contacted
Yeah. You have
by
enough of them that come
members,
to you.
yeah, and say, "Oh, you must have this problem, and we can help you with it." And we
Right.
say, "No, not really.
Right. Yeah. That's not our problem to
Right,
solve
not
right now.
really."
Yeah. Um, as we start to wrap, I always love to hear just either your favorite quote that you have, a favorite book. Maybe we'll start with a favorite book that maybe it's helped you the most in your career, if you have one.
There's just 30 years is a lot of books, right? So,
That's fair.
and
It can
and
be
and,
three.
and things change, but
We'll give you a few
I,
extra.
one book that I was introduced to maybe 10 years ago, that what I think was a really different business book, was one called The Go Giver. And I don't
Hmm.
know if you've heard of this
I
book.
have heard of it. Yeah.
Have
I've
you heard
never
of
read
it?
it, but yeah,
Yeah,
I've heard of it.
it's a skinny little book. It's a quick read. I think I read it on an airplane, between here and Connecticut. So it's a quick read, but it's a different approach to the go getter
Yeah.
mentality. And it really made me think about things differently, in how we're always looking to do something that we can get something in return for, that helps us
Right.
in business, helps us make a sale or something like that. And the book focuses on being a giver. So if you're in a position to help someone else in and it can be personal as well, but in a business situation that doesn't have any return for you right now, there is a high likelihood that somebody who you help with nothing in return is going to be there for you later, when there is an opportunity. And it's just it goes through a number of scenarios, and a little fiction about how it works. But it's the individual who introduced me to it kind of built their business from the ground up, a family business, doing that, and gave me some examples. And I think it's really inspiring, and it's a different way of looking at building your business and building relationships.
Well, probably the hard part about that is it's a long-term mindset, right?
Yeah,
Knowing
right.
that you may not get something back right
That's
away.
right.
And that's
That's
why it's
right.
so hard to do.
That's right. Because that's not,
Yeah.
it's the go-getters, our mentality, right?
Right. Right. I need, quick wins,
Yes.
immediate,
Yeah.
immediate wins. Right.
Yeah.
No, I love that. And, as you're building a company, hopefully that'll last for many, many years, right? That's the right mentality.
Yeah.
Long-term big wins. Yep. What about a favorite quote? Is there a favorite quote you maybe live by
Yeah,
or you think of
I have
often?
I have a lot of them. So we created a list of 29 fundamentals that kind of drive our culture, and we expect all of it.
29.
29. They
Wow.
rotate once a week. We focus on one every week.
That's awesome.
And
And when in your recruiting, are you checking the box for each of
yes,
them? Does this person
yes.
have it? Wow. I
Yes,
love that.
and they're it's not like values. They're actually
Yeah.
behaviors. We want people to understand these are the behaviors. If you're going to work for Banner Aetna and be part of our team, these are the behaviors. I don't personally believe that you can tell someone, okay, you work for our company and these are now your values. Everyone has
Right.
their own set of values. You can't change
Right.
someone's values, but you
Right.
can tell them, if you work for our company, then this is how we want you to behave.
Yeah.
And so I won't give you 29 of them, but
Yeah.
my
There's a lot,
favorite,
but I do want
yes,
to
that's a
read
lot.
them later.
My favorite is, and it's on our website. My favorite is find a way. And
Hmm.
I use that all the time with people who come back and say, we can't do it, and this is why. And I refer them back to that. We can't do it the way we've done it before, but we can find a way. And
Yeah.
Verta was an example. That was something we couldn't do for a number of reasons, and we found a way. We always can
Yeah.
find a way. So I love that one. You can't always do things the way you've always done it, but there's usually a way to get there. So
Yeah. That's such a good one. And part of that is just caring, right? If you care enough, you'll just somehow find a way because you
and
just
if it's
keep
important
working on the
enough.
problem
Hmm.
if it's important enough.
If it's
Yeah.
important, if it's not important, I'll let that slide. But
Yeah.
but if someone comes back with a no, if it's not a high priority, but if it's this some of these priorities we have for next year, they're important, and
Yeah.
we have to find a way to make them happen.
You call them fundamentals, right?
Hmm.
Are they listed on your website?
They are, yes.
Okay.
It's under
Okay.
our
So
culture.
perfect. Okay. So if people want to see what they are, because I love that as you recruit people or how to bring them on, you can look at each one. And
Hmm.
I don't know if you do a grading scale or on each one, if they're a 10 on find a way or whatnot, but that's a great way to do it.
Yeah.
Yeah. Love that. As we, wrap up, what would be your advice to either other CEOs or aspiring CEOs, like in your position? What would you find most helpful to share in your role?
I, I think a COO role is certainly different than a CEO role. Um, you have to be more, into the weeds
Yeah.
on things as
So
a
so that they're
COO.
less in so the CEO is
Yeah.
less in the
So,
weeds. Yeah.
so I think a lesson for COO in my experience is that it would be really hard to be successful in this role if you don't really understand the business.
Mm,
So if you're going
yeah.
into a new business in this role, that you have great organizational and operational skills, you have to know the business to really make an impact in that, and not just be pushing paper around and saying, check the box on metrics.
Right. You can't just be organized. You have to be incredibly well knowledge on the business and you have how many service lines under you, right? Or departments. You have to know those departments
Yep.
like they do, right? Like
Yep.
your department heads.
Right.
Yeah,
Exactly.
that's
Exactly.
great advice. I love that. Well, Joanne, so good having you on this. Really appreciate you taking the time. And we're really excited to see what your team is going to build. I know it's still early days, so I'm sure there's a lot to come.
Yes. Thank you, Matt. I appreciate you having me.
Thanks, Joanne. Take care.